We're live. Chris Craytor, welcome to the future of fitness.
It's good to be here. Thanks, Eric.
Yeah, it's great that we finally made it happen. I mean, we've been I got to moderate a panel with you, I think initially 2, 3 years ago now, at URSA,
That's right.
and got to meet you there. I was very impressed with your insights and answers to a lot of the questions on the panel. And, you know, like the industry goes, since then I've kind of run into you on hallways, probably
Right.
half a dozen times. And now we're finally sitting down to have a conversation. It's great. You do a lot within the industry. And even just now in the pre-recording conversation, I was like, oh man, you do that too. It's pretty extensive. So, I mean, you're involved with URSA now, Health and Fitness Association. We'll talk about that in a minute.
Right.
Is it ACAC? I think you guys have, what is it? 14? How many locations?
Yeah. Almost 14. Yeah. The
Almost
announcement
14?
coming soon. Yeah.
Yeah. Awesome. And then Well Health, which I didn't really realize until now. So there's a million things, a million trajectories we can take. So we're going to skip the introduction. If people want to know more about you, I would just go to his LinkedIn and look at his resume and everything he does, because there's so much to discuss here. So let's start with URSA, now Health and Fitness Association. You and I are about, as the date of this recording, about 10 days after feet on the ground in Los Angeles. What was your takeaway? And of course, the big rebrand and your part in all that. Like, give us some nuggets from that event.
Sure. Well, I mean, I think the energy was really high in LA. And well, first of all, thanks for having me. And I think the LA felt great, right? I mean, I think attendance was up. So booth space was up in terms of number of exhibitors. All those things kind of contribute to what is a more lively show. I think we actually had some of the equipment vendors who really felt like they were understaffed and underprepared for the first day of the show, and it's as busy as we've ever been. So all that's really good signs in terms of the industry and also in terms of just overall enthusiasm. The shows that are happening during COVID, I remember the first one in Dallas, we were all so happy just to be back together at that particular convention that we didn't really realize until now you're here today, how dead that actually was compared to what it was here in LA. And so, kudos to everyone who soldiered through that process, versus staff, all the people who kind of stuck with everybody during that process, because, quite frankly, it was not easy for the association, just like it wasn't easy for clubs. And being on the board now, I'm rolling off here after 6 years of being on the board. I got an extra super senior year because of COVID, kind of like a college athlete, that basically I got the extra year. And it's been awesome, right? We took it from where it was in 2020, which was, okay, are we going to survive? Now running a great show, back to putting, money away for a rainy day and all the things that you should do in terms of being responsible. And I think that's a great thing for the industry. And now as we move forward, the rebrand, now Health and Fitness Association, we're coming at a time where there's really nice positive momentum. The goal here is for certainly URSA or Health and Fitness Association as an organization, as well as the new board, to really take it to the next level and really say, okay, now that we're back here to kind of a level set, really positive, how do we then take this new brand and under this new big umbrella, continue to grow the influence of the industry? And really, the health was really, this rebrand's going on for about a year and a few months. And, early on, we identified that health was something that wanted to be included, simply because that is ultimately the product of what we're doing, whether it be, physical, emotional, mental health. This idea that we are contributing to the health of the members and guests who use our facilities, no matter what type of business you're running, whether it be a giant club or a tiny one, you're there to make people feel better. And I think ultimately that's what we're about. And I think the other big part of it is healthcare's $3.2 trillion industry. Okay. So when you're a $3.2 trillion industry and you're looking at health clubs as let's call it a $50 billion industry here in the US and $100 billion around the world, we're tiny. So how do we attach ourselves to that group that obviously has a much bigger footprint and mandate?
Yeah, I really like it. I guess, first of all, since we love acronyms, are we rolling with HFA now? Is that is that where we're going to go?
We're trying to do like the not HFA, because it's like everyone likes the ampersand. I heard people call it HAFA,
Okay.
Health and Fitness Association. So I think either one's going to end up getting done. So we'll see what happens, but I think either one's fine.
Yeah. Well, I think it's a really, when you look at it, like, okay, Health Fitness Association seems kind of obvious. Well, the obvious one is kind of correct, right? It is like, we've been talking about in this industry for a very long time, like, how do we integrate into the larger wealth and health and wellness economy? Like, where do we find our spot in that ecosystem? And I think this is a nice step, at least from branding, acknowledging that that's what we're part of. It'll kind of trickle down.
Right.
I mean, And what is your exact role within URSA? I mean, is it chairman
Yeah,
of the board of directors? Is that right?
that's right. Yeah. So I've been the chair of the board for the last 2 years. So I had a 2-year term as the chair and been on the board since 2018. So it's been a nice long run. Definitely time to hand the baton off. But to jump on to what you just said, I think the other big factor was that in the halls of Congress, or even in Geneva with the World Health Organization or some other governmental body or quasi governmental body, Health and Fitness Association is really clear
Okay.
compared to URSA, which comparatively was not. And ultimately, it's about having a really recognizable presence and voice, and being able to have someone remember who you are. Because ultimately, we were forgotten in 2020, and the goal is obviously not to be forgotten again. Should things take a downturn for some reason that hurts our industry.
Yeah. Yeah, and one of the things I noticed, because I spent a decent amount of time with the eGym team in their booth, and man, it was humming. Like it felt like business was being done again, which
Hmm.
was really, it wasn't just, hey, we're going to meet up for a dinner and have a couple meetings, but it was like, hey, we're intentionally here to do some business. I mean, that's something that you recognize and you noticed as well in these conversations that you had there.
Yeah, absolutely. I mean, we definitely felt that, and I heard that as well. I know a number of deals that were actually signed at the show, which is obviously good news for the suppliers. And I think that,
Hmm.
you know, I would tend to agree with you that people were there actually looking at equipment, looking to buy things, looking to transact, and looking for what's next. And I think that felt good. It really felt good. Now, who knows what the rest of the year brings, or even 5 years from now, but we've had this nice recovery period, or 2023 from most of the operators I've talked to. It was a pretty solid year. And most of the operators I know had a pretty solid start to January as well. So I think you're going to see continued catch up as people try to, renovate and or replenish their clubs. And I think that has not, at least in my view, it hasn't slowed down for our businesses in terms of what we want to do from a capital improvement standpoint. If anything, we're being more aggressive now with capital improvement based on the success of previous years.
Yeah, awesome. I've asked a lot of people this question, but when you walk the trade floor and you looked at, the brands and the products and technologies that were represented there, is there anything that caught your eye? Anything that seemed truly innovative more than some of the other ones?
Yeah, I'm not going to single anybody out, so don't want to spoil anything. But I think that first is always about trends. The Health and Fitness Association show always about trends, right? So that you have, one year it was all of this type of equipment. The next year it was something else. So this year, I think the trends that stood out for me were one, the continued emphasis on strength training equipment generally. I
Okay.
think all the different modalities of the strength training equipment and even ways of combining things into more space efficient configurations and bringing back even some of the more traditional pieces in a very customizable way. One of the things that I saw is a lot of the larger equipment manufacturers really trying to take their functional training studios, trying to take their free weight like racks and half racks and so on, and make them very much a kit of parts that could be assembled by a creative health club or fitness studio owner. And then the other is obviously recovery. We've all seen it. It's been very popular. Whether that be from cold plunge tubs to cryo to massage beds, you name it, red light. I mean, on and on and on. There were more booths this year about recovery than I even expected. So from my point of view, watching that trend, I would expect that to be a continuation of this year in terms of where clubs potentially are reinvesting.
Yeah. On the last day of the trade floor, I always like in the afternoon to walk and do all the recovery modalities because by that time, generally
You're
I'm
ready.
physically pretty exhausted, right? So it's like a good time to test all that stuff out. One thing that was really interesting to me, and then I saw the price tag, I was like, oh my God. It was the waterless cold plunge, right? You try this thing, it's like essentially a water bed with that folds over you, and then it drops
Yeah,
the
yeah,
temperature
yeah.
down to like 38 degrees. Uh, yeah, very, very cool. In fact, I want to follow up with those people and learn more. But did you try that one as well? That
Yeah,
was
it's so funny. A
pretty
bunch of my
interesting.
folks did try it, and they were very much intrigued. And my response was, "That sounds really cool. It's going to appeal to the casual cold plunger." I don't know. I think the purist just wants to get in the water and suffer.
Yeah.
Uh,
Well, it's
yeah, I
40
mean
grand.
that's really cool. I mean that's fun stuff to see innovate. So
Yeah. Well, it's $40,000. So, I don't know how casual of a person that would be, but I think I would imagine it'd be more of the, clinical
no,
settings.
that's a semester of college.
says the father with son in college. Well, let's get into some of the other really interesting topics I was hoping to talk to you about today. And
Sure.
now this has come up in conversations both on this podcast, in meetings, and things like that. Like, I feel like there's a lot of headwinds specifically for boutique fitness this year, right? Everyone's kind of projecting
Why do
this.
you think that is? I mean, what's your reasoning behind that?
I
Just
mean,
curious.
a lot of people point at real estate costs, right? That's a big one. I mean, just cost overall. I think inflation, is are people more inclined to do kind of an all-in-one health club, gym membership, or they, going to have, their Soul Cycle and their, an A, B, and C, right? Memberships. So that's one thing I'm not exactly sure. I'm not specifically in the boutique business, but I keep hearing that. And I'm curious to you, like, when you look at the potential headwinds for this year, and we're already almost at the end of Q1, which is bananas. But like when you look at the opportunities for the larger health clubs like ACAC and companies of that ilk, like where do you see the opportunities for growth? Do you think are you looking at challenges for boutique as a reality and something that you can maybe capitalize on, or is that not even on your radar? Or yeah, what's your vision here going into the year?
Yeah, lot to unpack. So, as far as studios in the market, obviously, I think there's like any market, there are going to be winners and losers. Like even when the stock market's getting crushed, there's always a few stocks that are winning. So I don't know that it's, necessarily all of the studio market that maybe is facing headwinds, but certainly portions of it are. Ultimately, there is, as you kind of indicated, a kind of retention problem, right? How often is that person who's coming to the studio doesn't have the kind of like what I'd say club relationship with the studio in many cases, but perhaps enjoys the workout. You know, how do they convert from a once a week member to a twice a week participant? How do they really drive that revenue? Or is it, hey, once every couple of weeks, I'm fine taking class at such and such place. So I do think that is something that has been interesting to watch. I'll give you a couple of kind of data points here on that in a second. But
Please.
on the health club side and where we look at the world, I've really been focused on, number one, battling inflation. I think clubs feel it too. Certainly if we look for new clubs to build, we're probably looking more new clubs to buy rather than build just because of the economics of building. We like the idea of buying more clubs. We're definitely looking. But, I think that the way that I would approach it is that we spend all this time trying to get our wages up and keep our team members, paid in a way that allowed them to keep up with at least what was reported as inflation. And that's been priority one. And now that we're here in 2024, I guess I'm looking at a couple of things. One is what are the social connections we can build in the club? So if anything, we're pushing a lot harder into social events and activities and ways for our members to engage with one another that creates some social connectivity. The other is, I think, this idea that clubs are going to start bundling, larger clubs are going to be bundling services. Some clubs already do it very well, even from the HVLP or lower price standpoint. Being able to just create an average revenue per member that tends to be higher by selling services that are potentially being consumed outside the four walls now. Recovery is a great example. The idea of selling recovery services to accompany a gym membership, potentially at a price that's lower than they could buy from an a la carte location, certainly is a nice value add proposition. We've seen bundling of Pilates. We've seen bundling of group exercise. This is something that's not new to the industry, but I think clubs that really are successful at getting those members who are willing to pay more or who have a more disposable income to pay on fitness, getting those dollars to stay within your four walls is going to be primary instead of having that leak out. So what are you able to do as a club to modify your package such that those, VIP members, if you want to call them that, or your high spending members, I like to call them the fit fluent, they love fitness and they're also a little bit affluent, that they want to come in and spend with you instead of another business down the street. So I think for larger clubs, it's going to be the revenue per member, maximizing that value, as well as building the social connection. And then the last part, that's outside of the more member focused piece is really the team training. How good is your team? How good are the people that you have serving your members? Because they're going to make a difference. And then, that will hopefully, through that investment in training and education and customer service support, be able to keep more of your members, because having a great customer service experience is a reason why many people come back to a business. I had great service there means I'm likely to return. So are you providing great service in your club to accompany those pieces that help keep your members connected and paying you more money?
Yeah, I want to all excellent points. Let's circle back to the first one. Can you give us some maybe some examples or tactical applications of uh, social events, community, things like that that you guys do or you're looking to do?
Sure. I mean, we have clubs that are fairly medically oriented. So, we have monthly luncheons with physicians. They're talking about pick a topic. So some of our senior members come in, they learn about something that's important to them, and they have lunch together, and now they're meeting one another, as an example. So how does that then influence? We have rooftop pools, so we did some polar plunges here this winter, where everyone got to come up and jump in the
Awesome.
water and then have a beer afterwards, right? So, those are two examples I'm thinking on top of my head, but all those are little, right? You may get 10 people, you may get 25 people, you may get 40, you may get, something in between. You may hold a big event for 300 people. But ultimately, it's about creating connections, which are done on a one-on-one basis. And that person who attends those events at your club now feels like there's more value. Wow, I did something here that's unique that I'm not just going to get down the street from somebody else, that I was able to get here. Been holding our appy hours, not happy hours, appy hours, where you can actually learn how to use the app and educate some of our members who are, need some help. You can serve wine if you like, that's also just fine, but it's all good. Like, I think anything that brings a member to the club for something other than a workout, right? And I think that to me is great. And then, what goes unsaid is group exercise. I think, everyone approaches it a little bit differently, but having great instructors and building communities there. So having special classes, bringing in guest instructors, just doing some unique things that are outside the day-to-day norm for those groups of folks who already love that group.
Yeah. Yeah, it's interesting. I mean, it sounds a lot like how maybe 10 years ago we would have associated all those types of efforts, initiatives, activities with boutique, right? Like these little community building events and things like that. So it seems like maybe it's just me, I haven't been an operator in a long time, but it seems like health clubs, larger health clubs like yours are starting to incorporate a lot of those tactics into it to kind of, essentially be a one shop for many consumers.
Yeah, in the boutique, it's interesting. They're fantastic, right? Great
Mhm.
member
I
community.
agree.
And you have the great independent studios wherever you happen to be, but you also have a lot of franchise studios. And I think that if you've seen a proliferation of franchise concepts, in many cases, like they're run a little bit differently than, say, the one person who just like lives and breathes it. No different than a restaurant group that has a number of restaurants. They can all be very good and tasty and excellent, but the sense of community around a single local restaurant is often different. And we recognize that. So, I think that the industry has changed somewhat, and not in a bad way. I think it's awesome that when we go to a new city and we see some of our most familiar boutique brands, it's always like, okay, well, I know I'm going to get a great workout there, right? Whenever we go, because it's going to be consistent and awesome. Like, who goes to who goes to Starbucks when they go to a new city? Lots of people, because it's going to be good, right? So it's not a bad thing. It's just a different type of sense of community than, say, the local coffee shop might have, uh, for example.
Yeah, really good insights. Y I think last time you and I did a panel, one of the things we talked about was industry buzzwords, right? If I'm remembering this correctly, right? So it seems to
Yep.
be every year or two, new ones pop up, and this one was absolutely, without a doubt, personalization with the name of the game, right?
Mm.
From Gerald, a friend of mine, he put it in good terms of like contextualization, right? Making everything more in context with the actual user or member. So when you look at like that trend, and a lot of it's driven by AI, which we're going to talk about for sure, right? But how are you guys looking to, or are you? I mean, are you following this trend? Are you looking to, further personalize or contextualize the experience for your members? How important is that to you, and how are you guys going about it?
Yeah, I think that, for one, I don't know that we're doing a great job of this, right? I mean, at the end of the day, I think it's one of those pieces that requires a big technology investment in this day and age, in terms of being able to deliver that to the consumer. What I will say, from a personalization standpoint, there's two ways that we would approach it. One, we're a larger group, right? Larger, bigger box club with hundreds of classes and all of that. So for us, the personalization becomes more of a breadth of activities and a breadth of opportunities for you to engage, and being able to have something that fits where you are. If you're looking at it, one of our clubs where you have indoor, outdoor water, you have tennis, you have obviously all the regular classes, you have strength training equipment, personal training, small group, all of these things are all together, right? The challenge is, how to identify those folks who would be interested in those various modalities and get them engaged in something that maybe they've never tried before. I'll throw pickleball in the mix, right? So I guess like the way I'd approach personalization in our world as a club is more about offering enough that the individuals can pursue, less about doing prescriptive type personalization and optimization. I think a lot of folks are getting into this biohacking of doing their blood tests and figuring out what vitamins they need to take, where they're deficient and all this. I have a brother who lives in Boulder. So if he listens to this, I think literally everyone in Boulder is optimized at this point. I'd like to own a supplement shop in Boulder. I think,
Yeah.
I think that ultimately, there's been a lot of people focused on that. I think we do understand that. I think it just hasn't been core. The last piece I'll bring up is on personalization. We tend to be a one-on-one training group. We do have some small groups and some trainers are good at that, but we do a lot of training, and most of the training we do is one-on-one. I know it's a bit old school and people don't talk about it, but at the end of the day, those folks who are with us, who are working with our personal trainers, are getting the most personal type of attention you possibly could imagine. And so as you've seen workouts move away from the kind of one-on-one experience into a coach-led, group-led type economic model, having that one-on-one attention, in my mind, doesn't actually get more personal. And the last piece I'll throw in is on the medical side. I think we do have a number of programs that will run on the medical fitness side of the house. So, when you're meeting with a nurse that we have in all of our larger clubs, talk about your health history and talk about, where you are on your personal health journey, and then tailoring an exercise program to meet you where you are. We do see personalization in that way. But ultimately, when we think about it from a technological solution, I don't think we're there yet, although we do have an e-gym circuit we're trying out. So I think we've had a good number of members really go through that and really enjoy that. And that is a nice way of kind of dipping our toe in that one.
Yeah. Well, they make it simple, right?
We
The
do.
gym crowd, the technology I got to play with was really, even I could figure it out. And yeah, one of the things that we talked about before we started recording here, Chris, was, it really piqued my interest, was, how we can set up health clubs and gyms and the talent and the staff that we have within it, as far as defensibility against artificial intelligence. Like,
Sure.
everyone's worried about it, right? I don't know if you listen to podcasts, you listen to Rogan, but I just listened to the Ray Kurzweil interview that he did, the guy who originally kind of identified the singularity coming. And, tough read. If people want to read a book that's like wading through molasses, at least for my intellectual capacity, that's a really hard one, but
Yeah.
very fascinating, kind of scary, and everyone's like, my wife's worried about losing her job, someday, and coders, feel like they're going to, so we're all have this kind of either varying degrees of fear around AI. So when you look at like, how do we keep our staff and our health clubs, defensible against AI? What does that mean to you exactly? I'm super curious about that.
Yeah. I write a weekly, or not weekly, but thank God, monthly letter in the CBI magazine that is put out and by Earth and now Health and Fitness. And I think that, I don't know, maybe a year ago, when ChatGPT was really just getting its first sea legs, I actually typed in the prompt. I said, what are the parts of the health, in-person health and fitness industry that cannot be taken over by AI?
Mm.
I asked it the question. And so what's interesting is it dovetails a lot with where we are strategically, which is social connections among people, like going and having that in-person experience. It's not going to change. We're social creatures. You've seen this idea of remote work versus office work. I realize that plenty of people never want to set foot in an office again. I get that. That being said, I do know that having social connections and having, interpersonal relationships, AI is not going to get in the middle of it. Just like they're not getting in the middle of the one-on-one personal training session if you have that relationship with your trainer who knows you. But I also believe that putting your head in the sand and saying that AI won't affect us isn't a great strategy, because ultimately it's going to have to influence how we do our business. Because I'll use examples. Obviously marketing is coming into this, right? With their AI tools of optimizing the right kind of marketing for the right type of person. How do we make sure that Chris doesn't quit, right? And it may mean that I need a phone call, but Eric, it looks like based upon what we know about you, you need to text. So how to actually optimize the experience of the marketing side, on the sales side. I think you're going to see some of these things that were done by people, right? If you think about selling, why not go online and craft your membership online with somebody and build exactly what you want versus having to, say, approach an office and go on a tour, right? Because a lot of people prefer to do this from the comfort of their home rather than actually have to go in anywhere. But when I think about clubs, like, man, part of being in a club is being around people and having a shared experience. So it costs a lot more, and it never seems to be an issue to sell those tickets for a hell of a lot of money. I think that people really do enjoy that in-person feeling, but when that happens, I think, it's incumbent on clubs to make that as enjoyable as possible. So if people love that and they come in and they experience like your friendly team or their other members who they like or their workout buddies and that type of thing, then man, they're going to have a great time. If they come in and they're all alone running on a treadmill and no one ever talks to them and no one ever engages them, no one ever says anything to them, and then they walk out and leave, at some point they're going to wonder if they're better off, joining a club that's the cheapest possible and putting a basement treadmill in. And I think that's where, if we're going to be really trying to combat this world of what I would call tech-driven solutions instead of in person, we've got to step up our game and be better, and that ultimately will be the key. It is disheartening. I go to the grocery store and everything's self-checkout, which I hate, obviously. I mean, some people probably prefer it, and if you do, fine. But I mean, for me, like, this idea that that's better than someone who's there who I can talk to and hang out with, I don't buy it, because invariably I screw something up and the attendant has to come over anyway and back to square one, right? So I think that there's there's an advantage to that. Now, on the AI workout side, I think actually being able to build in, and I'm sure there's plenty of folks that you can partner with as a club company already out there now, right? But being able to build those customized workout programs for people when they're not with trainers, I think is a huge opportunity. People get bored of the same stuff all the time. And if we can do a better job of, number one, providing workouts that are going to be effective for that individual, using AI tools and using what we know about that member, and then being able to measure results to show that they're making progress by being there. I mean, I see that as a just absolutely huge opportunity for the industry, because we are terrible at results. We're much better at sales.
Yeah. And it's, I've said this on this podcast numerous times and probably in many more conversations, but program design doesn't really need to be done by the trainer, even if it's a personal training setting, right? Like, it's time consuming. It's never like, there's a lot of different things that technology can do that, we may not be able to do, like, bring in data from, wearables or whatever it may be, even subjective data given to you by the client that can adjust, that way we can focus more of the time on the human to human stuff, right? Like, I don't think that's necessary. A lot of people who coaches or trainers out there who pride themselves on being one of the best program designers out there, like, I'll just clue you in, as no one really cares that much, right?
No.
Unless you're a professional athlete, right? That's about it.
Right. Well, I feel like I mean, I use the gym. We build a library. I mean, whether you actually are really diligent about planning everything out, or you're somebody who just goes in and figures it out as you go along, a lot of us have developed our own personal libraries on that, and we still have a great time doing it. I think where we look at the trainer, someone to maybe push you a little harder than you would have gone, right? Or every once in a while to show you something new. But I agree with you. I think people sometimes inflate their value as it relates to certain aspects of their jobs. Program design potentially being one of those.
Yeah. Slight shift here, but it's something that, and maybe it's just my age, right? I'm in my upper 40s now, and I feel like now in my life is when I've never seen this much comparison of generations. Like, everyone's like, the boomers versus the millennials, and like, Gen X and Gen Y. Like, there's always like, this seems to be this categorization of people by age and the difference between the generations. I mean, when you guys look at how and I think a lot of that has to do with how fast technology has grown over the last 30 to 40 years, right? Like, people, I don't know, we're probably about the same age, Chris, but like, we probably grew up with almost no technology, right? Like,
Right. No internet.
I was a latch and key kid, right? I would just take off, say, be home before sundown. That was what I did. And now, like, many generations are born with technology, just digital natives, right? So I think that's kind of part of it. But anyway, I'm going off on a tangent here, but the point I want to make is, like, the question I want to ask is, Or do you guys intentionally look at different generations and how to serve them? Or is that critical to what you guys do as a strategy? Or is it something that you're aware of, but you're not really focusing on a whole lot? Like, how do you tackle that?
Yeah, it's interesting. We don't typically target aggressively the youngest demographic. Our clubs tend to operate at a price point that is towards the higher end of the market. Our average age of members is oftentimes closer to 50. Certainly in some cases over 50, and always closer to 50 than 40, right? So I think they have an opportunity, obviously, to attack the Gen Z, as you want to call them that, with technological solutions. And people really invest a lot of money in catering to that. But I also think in our world, the consumers who have the most disposable income and the most wealth aren't 25, despite what Instagram would want you to believe, right? Our core member is somebody who owns their home, is established, is stable, has disposable income or wealth, certainly enjoys a higher level of service and attention when they walk through the doors of their fitness center, wants to be part of a community as opposed to just, being a member of a place. That really you're somebody who is connected there. That's like our core consumer. And I think there's this huge temptation to over technology everything. And I'm the last person to look. I'm not a paper guy. I'm not like print tons of paper and print reams of it and all of that. I'm not. I'm certainly not somebody who's trying to be a Luddite and say, hey, no tech, and let's all just write our names on a piece of paper when we walk in the door. But I think that there's a tendency to overemphasize technology at the expense of human connection. And ultimately, and that is a challenge, because if you're trying to cater to somebody who's, say, 70 years old, I'm thinking about my parents who are in their 70s, and you're catering to them, like, they don't want to sign up on an app. They want to talk to somebody, right? They don't want to, I've been to some locations where you literally show up, you scan a QR code, you buy your membership on the app, you scan your barcode, and then you walk in. That's the only way to even get in the club. And that's the only way you can buy a membership, is just to buy it on the app. My parents are never joining that club.
Yeah.
They're never going to go there. And in the US, there are millions and millions and millions, tens of millions of these people, right? And so I think that the tendency goes that way, where if we look at the generational, we're so worried about what this next generation is doing, that we're actually forgetting about the opportunity that's in front of us. Because when we're looking at somebody who's on the, not that you have zero technology, I'm not advocating again for that, but this idea is like, wait a minute, like the older active adult is a massive opportunity for us still. The number of people who are getting on Medicare grows 8% a year. Okay. 8%. That's 65 plus. People are living longer and longer. People want to do things longer and longer and live healthier and healthier. So there's a real need. And I don't understand why we try to, we all fight for the same people who switch memberships, because they switched apartments, when I can have somebody for 10, 15, 20, 30 years as a member of the club. To me, that's just a better value. So while I agree that we do get generationally focused, I think too much of that generational focus is on trying to attract the younger generations at the expense of actually understanding the opportunity that literally is waiting outside your door.
Wow. Well said. Very grounding. What you stated there, Chris. I think it's really good. I want to give a certain amount of time on this interview too to Well Health.
Sure.
Really interesting. I'm embarrassed to say it wasn't really on my radar until we started talking, and then you started giving me some of the numbers and the insights of what you guys are doing. I'm like, this is fantastic. So can you describe like what is Well Health? What is your involvement there? And then we can kind of get into some of the insights that you're gleaning for this year.
Sure. I mean, Weld started out as an internal project at ACAC. So we've been long doing physician referred exercise programs, and we wanted to track our outcomes. And anybody who started building software can tell you that it's never done. You just keep bolting stuff onto it. And over time, we realized that there were more opportunities in the space. So we started working with Johns Hopkins, and then we found out that the CDC, or the Medicare, was going to be, or CMS rather, was going to be reimbursing for a diabetes prevention program. So, maybe we can help clubs facilitate that. We won a grant with them. This goes back to 2019. And then all of a sudden 2020 happens, and everyone disappears from what I call in-person fitness, right? It's like, oh crap. Like, a lot of the work that we've been doing was now pushed aside. And quite frankly, that wasn't the first thing clubs were bringing back when they reopened their doors. They were worried about masks and sanitizer and spacing and all those things. So For Weld, we continued to serve our clients there, but then we started working on processing all sorts of different kinds of claims. So we work with healthcare. We help process claims for retail settings all over the country. We work with obviously health clubs. We work with YMCAs, JCCs, pharmacies, community health centers, you name it. The idea is that retail settings, places that are outside of the clinical sphere, don't have a lot of the tools they need to adequately bill for for services and administer those programs that are going to get them paid and bring participants into their location. And so we started working on that, really in earnest, during the pandemic, and then continued to build that out. We added support for some of the most popular third-party payer programs in the industry. So if you know about those, obviously there's Silver Sneakers and Optum with the Renew Active and Active and Fit from ASH. And there's a bunch. We won't go into all the programs. And then trying to help clubs actually get paid more money by delivering those. So, we started working with clubs to simplify that process, make it easier to determine who's eligible, make it easier to get paid, make it easier to turn off people who potentially aren't eligible. So we put all that under one big platform. And so with Weld, we started, we were really small, and then we kept on growing, and probably from 2022 in October till now, we've grown our location count by about 10 times. So we're at about 6,000 locations we serve around the country, and continuing to grow and continuing to add services and payers. And I think our goal in a big picture sort of way is to capitalize on what is an inevitable, even if slow, movement towards third-party paid activities and services inside a community setting. And so speaking from a fitness standpoint, we don't see that slowing down. We see that increasing. To the point I made on Medicare growth, the programs that serve Medicare members, that is those people who are going to get a Medicare Advantage plan and have a free fitness membership, those programs are growing by 8% a year. So what does that mean? That's 8% of the, if you think about 8%, that means that group, and right now that size of that market is about 15 million people who signed up. So on the Medicare Advantage side, so if you're going to go 8% a year on that, it's $1 million a year, right? Or more. So every single year, that many more people are getting a free membership. Now, granted, there's some people who fall off on the backside of that, right? Who pass away or otherwise can't work out. But each year, all of that's coming. And we grow our health club industry from 2010 to now at 3.4%. So it's growing at double the growth rate, right? Coming in. And that doesn't account for things like a Gym Pass or a Class Pass or Fit On or Ziamo, these corporate Husk and Global Fit, corporate entrants who are now continuing to mine corporations for group-based memberships. So putting all that in together, the fundamental sea change is that, just like a doctor's office accepts all types of insurance, we at a health club need to understand that while we're still going to get cash pay, the percentage of people who are going to be insurance-based or third-party based pay is going to increase and is not slowing down. You mentioned eGym. Their WellPass network has just been introduced in the States, and it's huge in Germany right now. The biggest country for Gym Pass isn't the US, it's Brazil, right? I mean, they will continue to grow here in the US market. And, you have this great, kind of group of members, and who's processing, who's dealing with it, who's making sure that it's all being handled properly. And so Weld Health, we felt like there was room to step in that void to make sure that the two sides could talk to each other and everyone felt good about the programs and the transaction.
How does that work from the member consumer perspective? Are they made it do you help inform them of the programs that are available to them? Like how does it, I understand the involvement of the health club and why it's so critical. And I could probably guess to how a lot of that works, but from the member consumer side, how do they interact with this?
Yeah, there's so Well doesn't take the position of marketing programs. We try to be agnostic. We love them all. We think they're all great, but I think the members hear about it often from their health insurer. They're marketed to directly. I think that you have a couple of challenges for clubs. One is, which programs do you decide to take? Which ones are right for you? Because they may not all be right for you at your price point or reimbursement level. And then, beyond that is from a member standpoint, when they come in, a lot of times they don't know what program they have. What do I have? I think I should be here. How do I sign up? And so I think that's a challenge. And the last part is once they're there, many of these programs are based on visits. So if the person, not all, but some, but the majority are based on visits, if they don't attend, club doesn't get paid. So there's a lot of groups out there trying to figure out how do I get that person to visit more times so I get the maximum amount of revenue. Groups like V Labs, for example, are really focused on how do I grow that business by recruiting the members to be more active. So I do feel like those are the challenges for the member. On the other side for the member is, what are the rules around your program? Some of them, you mentioned this early on with studio hopping and people going studio to studio and what's that look like in the headwinds and all the competition. A lot of these networks, and some of them are 25 to 30,000 clubs strong in terms of size, allow for a lot of flexible use between various locations. So as you move from location to location, so a person can have a membership that is either through their company or through their insurance plan that allows them to visit whatever location right? So it's kind of cool, right? Like, so, wow, I'm going to go to a stretching location this month, on Saturday, but on Friday, I want to do Pilates. Okay, cool. I can just do that now. And it's all paid for and free to the member who pays nothing. So that's a pretty good deal if you're a member, right? That's pretty sweet. It's pretty awesome. So, it's hard to imagine that type of activity doesn't grow. So let me get this straight. It's cheaper and more flexible. Okay, that sounds like a good deal. And so I think that's where we feel like there's going to be continued growth. It certainly as the members figure out that, how easy it is to get the workout they want.
Awesome, man. And, HSA, FSA was another big topic of conversation. And once again, on this podcast and at the Health and Fitness Association conference, but how much focus are you guys putting there right now, or is that something you're going to kind of wait and see?
Yeah, and we have some plans around that. I think in terms of how we would approach it. As I mentioned to you, kind of in our opening conversation, I think it's pretty new in how people are going to reimburse for these services in clubs and studios and the like. I think there's a number of folks out there really trying to help consumers achieve access to their HSA, FSA funds for fitness through letters of medical necessity. And, I think it's very new, so it's frothy. We're going to take a patient approach. The hard part about software, by the way, is once you build it, it's really hard to tear it all out and then basically start over again. You end up just tinkering with stuff that maybe was crappy to begin with, right? So you had a bunch of flawed assumptions that you're now trying to repair for the next 10 years. But I think it's going to come. Right? There's no doubt it's going to come. Under what context and how to best approach it. And I'll give one example. I think, because we help a lot of groups like say YMCAs deliver their evidence-based health programs like enhanced fitness for fall prevention or certainly diabetes prevention or Live Strong Cancer or the like. There's no reason why those programs should not be eligible for HSA, FSA funds. And by the way, those programs come with a membership in most cases. So if I'm looking at it from the position of a health club operator, those are things that are really easy to get paid for because there's no drama about what is necessity. If a physician recommends somebody start working out because they have cancer, what program could you build for them inside of your clubs that makes taking HSA and FSA payment 100% a no-brainer, right? And these letters will last, the letters of medical necessity will last a year. So there's certainly an opportunity for you as a club owner or operator to sell a year-long membership to somebody up front, because gosh knows in December of this year, everyone's trying to use their FSA funds before the 31st. You can sell a year-long membership to somebody. That's a pretty cool opportunity. I predict that in December, there's gonna be a ton of people jumping on this bandwagon.
Yeah. Super interesting. Well, Chris, I appreciate you coming on. Last question I always have is, as an industry, what do you need help with? What would you like to hear from people about if they're going to reach out to you?
Oh gosh. I think, well, there's all the stuff that I'm in my brain now going, man, what are all the things that have happened to us recently that we need help with? Ultimately, I think for me, it's going to be around managing the people side of the business. I think everyone goes to MBA school to learn how to run spreadsheets and build models and do all this. But, managing the people side of the business is easily the hardest one. We have at our clubs about 1,500 people that work for us on full and part time, and probably a couple thousand in the summer. And so how much of our business is people? A lot of it. And how do we develop better techniques to train our team? How do we develop better techniques to motivate and inspire? What are the areas in which we can become an employer of choice for people? And then, and by that return, provide something of value to the team. Like, that's where my brain is. I think that, we can pick out a treadmill, we can pick out paint colors, but the nuance and the art of how to develop and run and manage a great culture and a great team, I'm always curious about techniques for delivering that and learning more about those who do it well.
Awesome. And if people want to get a hold of you, Chris, I mean, I know you're on LinkedIn, fairly active there. Anywhere else you want people to go?
Yeah, you send me an email. It's chris@acac.com. So, or chris@weldhealth.com, either one, WELLDHELTH. HEALTH. How you get it up? It's the end of the day.
We'll get it out there.
Thanks, man. Yeah, either one, you send me an email. It's great. Love to hear from you. And, Eric, it's been a true pleasure. It's great to reconnect on this, on the podcast. And, I appreciate you having me on. Hopefully it was an interesting discussion for you.
Oh yeah, for sure, man. Pleasure's all mine. So that is a wrap. Ladies and gentlemen, Chris Craytor.